Okay, the other type of rhinitis is a result of a viral infection or viral invasion. So this is what we call acute viral rhinitis, and also what's known as common cold. This is one of the most common infection. Now again, this time again, this is an inflammation of the nasal mucosa, but it's as a result of viral infection. So basically, its symptoms are caused by a viral invasion and a reaction of the immune system to this viral invasion. The 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 um, the infection is transmitted through airborne droplet and also could happen through direct hand contact. So infection control and teaching about infection control is crucial. Now, the other theory indicates that there's the theory that indicates that viruses, they live somewhere near the root of the nerves, and they are inactive until they're waiting for specific conditions, and these conditions lower the immunity of the body. And an example of that, when there's an extreme stress, whether physical or emotional or fatigue. So you may have experienced this or heard about it. Yeah, if you work for a week non-stop, or you've been exhausted, and the next thing happens is that you develop a common cold and you cannot recall that you are around people with common cold. So that's where this theory comes from. Now, when these patients are rarely, of course, hospitalized unless the viral infection gets complicated, or if it's an elderly patient who cannot take even a viral infection, or somebody who's severely immunocompromised. But in any case, the symptoms that are reported had to do with the irritation of the mucosa of the nose. So irritation, sneezing, redness, watery eye, depends on depends on the reaction of the immune system. You may see muscle weakness or muscle ache, headache, general malaise, nasal obstruction, watery nose, watery eyes, and so on. The diagnosis is made based on the history and the symptoms of the patient. In the physical exam, if you visualize the nasal cavity using a nasal speculum, you will see the erythema or the redness. It's a profound internally. Also, the patient may have a dripping nasal discharge at the same time. Now, this discharge is important to differentiate from the bacterial discharge or the bacterial infection discharge. The the viral infection in general, viral infections, they cause a watery or clear discharge, and because usually the allergic reaction. Okay. Now, the discharge that's caused by viral infections in general, usually it's clear to watery, and that's because the immune reaction is not as significant as it is in the case of bacterial infection. However, if this acute viral rhinitis or common cold lasts for a few days, the accumulation of white blood cells can lead to a production of a more thick or purulent secretion that become yellowish. Now, the confusion is always, okay, is this a bacterial or is it a viral infection? Because one of the differentiation between them is that the discharge. Now, in general, if it's less than a week, it can be treated as viral infection, but also we will be looking at other symptoms. We don't have to wait 10 or 14 days to say, okay, this must be bacterial because it's not resolving. There are other symptoms that not typically viral infections, such as severe or high fever. But in general, in viral infections, usually give a watery or cause a watery to clear discharge. Now, medical management, there is no indication for antiviral or antibiotics, of course. And this is very important because we want to make sure not to abuse the use of the antibiotics, because that can lead to increased resistance and so on. So mainly the medication, or sorry, so mainly the medical treatment is geared toward symptoms relief or symptom management. The great majority of patients with acute viral rhinitis or common cold, they treat themselves at home. All it takes is fluid, rest, and vitamin C. And some theories say zinc, and we're not. It's not confirmed the effectiveness of zinc, but fluids, antihistamine for congestion, and rest should take care of it. Again, no antiviral, or no antibiotics are indicated. So it's important to teach your patient. Okay. So again, the patient needs energy, need to reserve his energy or her energy, so the immune system fights this infection. Proper diets with high calories, fluids, rest, vitamin C, all that can help. If the patient has fever, Tylenol is a drug of choice, antipyretic, and it works as an analgesic. The complication that we have to keep monitor for is what we call secondary infection or superinfection, when if the viral is not treated, the bacterial infection can develop, which usually sinus. Again, we want to make sure that the patient understand that intranasal decongestion spray that they use for decongestions not to be used more than 3 days. As you learn in farm, this can, the abuse of decongestant spray can lead to what we call rebound congestion. Also, keep an eye, teach your patient to keep an eye or monitor for and report symptoms that can indicate secondary bacterial infection, such as a high fever, or if the discharge become more thick and the color become yellowish or greenish. If the glands around the neck, the lymph nodes, also become swollen, and if there's a sore throat or pain in the throat, patients should report that as well.